Apologies from Councillor Martin Rodley. And just for your information, David and Linda, you'll see me and Ariana and Gary here. Terry's online from Whangamata, Robin Sinclair online, and Morning Rex. As discussed, Linda, 5 minutes each this is public forum, so it's not a discussion. I'll be asking the committee if they want any questions or clarification, and the normal respectful discussions. And yeah, so are you going first, Linda, or David?
We're both going to just sort of interact with each other for the 10 minutes. But Sally, could I get you to just repeat what you just said about the forum? Because it just broke down as you were saying it and I couldn't hear it.
So just the normal standing orders around public forum. So you present, it's not a discussion as such. I will ask any committee meetings people for questions for clarification, and then we will take any information away that you give us and discuss at a later stage. But I just wanted to make it clear that it isn't a general discussion in public forum.
Thank you.
I just need to move Christy and tell her that the apologies are received.
Happy to move.
Right, thank you. I'll second. So, Linda and David, your time. When it gets to about 8 minutes, I'll tell you you're needing to wrap up, okay?
Thank you. Go ahead, David.
Okay, Sally and members, thank you so much for allowing us to speak to you today. I have a couple of questions that I'd like to put to you, Sally, as the chair of the Emergency Management Committee. As a result of the decommissioning of the sirens that we have on the peninsula, we've undertaken a number of exhaustive research activities, and one of them is into the costing of sirens. Are you aware that the figures that were portrayed by the TCDC were a little misleading in their value?
I'm not going to be answering direct questions. I'm writing them down. As I said before, this isn't a discussion. This is a presentation. I'm staying quite strict to that, and strictly, that's bad English. And so I'll be writing your questions down and thinking about how I'm going to respond, but it isn't a discussion. This is public forum.
Yes, okay. Well, I'll put it in another way. Our research has identified that the information that was presented by TCDC was publicly misleading, and that our research has identified that sirens could be placed within the facilities that wanted them between $100,000 and $70,000 fitted. That required consultation with 6 companies, and they are paired. The pairings are manufacturers and their New Zealand counterparts for installing. So that's 6 companies that have come together with those figures. So as a presentation, that is a fact that we have available to us.
Thank you.
Okay, the other research activity that we identified is that a lot of discussion was based on the effectiveness of sirens being 44%. That has been debunked. I have had discussions with GNS Science, and I've identified that the document that they referred to was a presentation put forward to the Bay of Plenty as a review, and the document and the methodology that was used was for a cost benefit analysis, which has nothing to do with operational effectiveness. And I've also raised that issue with Northland, and they are quite aware of that as well. And I've also raised that issue with the Tauranga City Council, and I've spoken at length with GNS Science about what they use that document for. They also identified for me that their waiver on that document basically means that they are not responsible for any of the content, and that the information on the effectiveness of sirens was not their input and it came from elsewhere. And their rider on that document is that they are not responsible for any of the content. So that needs to be documented as part of the presentation given to you this morning.
Thank you.
Okay, so the other part is that Whisper has been identified. It came out in the Mercury Bay Informer as an article. We would like to know in due course what the Emergency Management Unit program is for public information, and how this is going to be presented to the public as an emergency device to look forward to in the future.
And a question added to that is, and who is paying for Whisper, or who has paid for Whisper?
Yes. The other issue, particularly with Whisper, is who is going to do the presentation? Is it going to be the Emergency Management Unit, or is it going to be Civil Defence Waikato? Now, I should tell you that to be open and fair, is that I have asked for official information requests by the Civil Defence to the Civil Defence Waikato for their role in all of the rollout of Whisper for the public, so that we can have far more early warning than we've had in the past about new events. Okay. That's about the main questions, but for your information, part of the report that was presented to by GNS Science identified that there was a shortfall and issues related to the Red Cross app. I have contacted Red Cross app people, and we are in discussion about the improvements that were recommended in the report as to how they've gone ahead with that, and are they able to achieve the recommendations. And if that information comes available, I'm very happy to share it with everybody, because any upgrades to that Red Cross app would be perfect.
Yes.
That's about as much as I have at the moment.
Thank you, David, very much. Linda?
The only thing I would add to the discussion is that we are in the process of having communities that are interested in putting up their own sirens. And so a part of that discussion is obviously going to be with TCDC and the Emergency Management Committee to ensure that you're going to support us and not put obstacles in the way. So that's definitely something that we would like to have you discuss, because we need to know where we stand, because you're the ones with the authority.
Yeah, can I add to that? The question that has already been put to TCDC is the process a building consent, or is it a resource consent? And thus far, that we have not been able to provide guidance from the council representatives on that, which is a little concerning. We're happy to go with any process that's available, but it needs to be obviously the right one. It may have
and the right one for each site, I would imagine, because could vary.
Well, yes, it depends on each site review as to whether it would be simply a building or simply a resource. But I have in the back of my mind that it will need to be both.
I've noted that. Thank you.
Okay, and the other thing is that you should know is that I have, for Pauanui in particular, we have 3 standalone siren poles here. And I did ask if we could use those poles and put new sirens on top. And the answer is emphatically no. Okay, which I find a little disconcerting. But having given the, the people have made their decision, that's fine. But we are going to progress, and we need to find the right way, and we need to find a way that the council and the emergency management unit are cooperative in helping us try to achieve a public aim.
Right. Well, thank you very much for your time. Is anything I've taken notes and the committee will digest that and we'll go from there. So thank you very much. Stay safe in your communities and yeah, good to see you face to face.
Yes, likewise. And thank you. Bye
Thank
for
you
now.
very much.
Bye.
Bye-bye. Thank you. Have a good day.
I'm happy to move that we receive the public forum presentation.
Thank you, Robin. I'll second that. Thank you. So now we're going to go, is there any items not on the agenda? I don't think we've got any conflicts of interest, not me, up to me to ask, to decide. And then we'll go on for the minutes for confirmation. As I said before, I'm going to go through quite briskly. The staff are really busy and it's a really challenging time right now. So we'll do the business and stop me if I'm going too fast. I'm in the ward sister role today and a lot happened when I was a ward sister. So the minutes, have I got someone first of all to say that they're a true and correct record? Anyone prepared to move that?
Yep, happy to move.
I'm happy to second that.
Thank you, Robin. Is there any discussion on those minutes that aren't contained in the rest of the committee report? If not, I'll move that. Thank you very much. And we'll go on to the district manager's report. Thanks, Gary.
Madam Chair, good morning, everybody. So I'll take the report as read. So just going through it quickly. The disconnection of the sirens has been completed. It was completed on the 20th of September. The poles we are going to be working through in due course the decommissioning of those assets because they're on council land and we just need to determine what we're going to do with them.
Right.
So that's it. You'll see a letter from Mr. Youngs, who's just been on the public forum.
Yes.
He did request a building or a resource consent. So the direction that we got from the manager of our planning department was that he needed to get independent advice because it was quite complex. However, he's come back to us with another Lagoina request, which I'll be dealing with in the next few days. Right. Which is another add-on to that. So
right. Okay.
Which is fine. So yeah, the tsunami evacuation project. We'll talk about that as part of the work program, but we've made really good progress. We're ahead of schedule there. So Pam's got 50 large signs up. They're looking really good. I did a road trip with her just a few weeks ago and we went and visited some new sites and had a look at them. So,
any feedback?
I haven't had any, but Pam can speak to that during the work program, Terry. One of the things I am incredibly grateful for is our parks contractor. They've got a dedicated person who's actually putting the signs up around the whole peninsula for nothing, which is saving us an amazing amount of money, which means that the project, we can expand the project a little bit more.
That's right.
I just So we're going down to the Delta resurgence. Once again, we've got ourselves quite heavily involved in that. Although we are not working in a welfare capacity, we are very busy in what we call a conduit capacity. For example, the last 3 days, we've been working with the DHV because they assigned 2 dedicated staff members to the Coromandel, and they're quite new. And what has happened there is they've got a mobile home and a 4-wheel drive, and they're going to go into the more remote communities now. There's 5,800 people on their list still to be vaccinated. And so they've come to us for support. So we've been very busy identifying sites, working with staff to get access to halls, etc. Very busy in that space. But it's working all right, and it's making sure that it happens rather than it gets quite clunky as it has done in the past. And having 2 people dedicated to work with instead of medical centres and other health providers makes our job a little bit easier.
Good.
Watch the space regarding COVID. We're getting a lot of anecdotal information out, especially this morning, that things are not looking flash, so we'll wait and see. Moving on, spring summer planning. So this is ramping up now. So we've had our spring report from NIWA indicating that we'll have a similar summer to last year. And all indicators are that we'll have a La Nina, which means that there's just enough rain here and there. And but summer's got long, and I'll be stretching into April and May. This morning, I received the first of the summer reports, and the outlook. They've sent out the outlook for cyclones. And we have now, they've already put us into what they call an elevated situation, where they believe that New Zealand will have between 1 and 3 cyclones this coming cyclone season. That's from November to April. So we had none last year, they were predicting 1. So we had a couple of storms. So I've just got that data here, I'll circulate that as part of my report. So yeah, so we'll have the summer report ready by the end of November. And we'll have some economic data in there, we'll have some comparisons, and we'll just provide it the same as we did last year. So going on down, as you'll see, we've got a digital campaign. One of the things that we're working with Toms is managing the summer risk, which of course is water at the moment. And so as you'll see, there's quite a different style of digital campaign that they have, that Coms have come up with, which we quite like. So we're going to support it, but also the Three Waters guys are going to put into their budget, we'll put a bit of budget in, and Coms will put some budget in. So the 3 of us will work together. This kind of thing, what it does in February, March and April, if we can get out there early and get that sort of messaging, it makes our life a lot easier, especially if you've got fire risk and those sort of things. So we're also contacting water tank companies because we're going to do another big push on storing the outdoor water tanks for outdoor use. There's minimal requirements building wise, and that was very successful last year. They ran out of tanks. So they've got a good stock now.
Wow.
Okay, summertime magazine. The magazine is out. I wasn't sure whether it would be out in time for this meeting, but it's out, and these just give you the page example of. We've got a couple of pages, so there's just one page of what we're doing. Now, for your information is the final draft of the business continuity management policy and the plan. So I checked with Rob as to whether the committee needed to sign this off to build into council, and the answer was no. It would go to the leadership team because it's largely an operational policy. It was just to give the emergency management committee heads up, so you're not surprised when it pops up. So Helen's done a lot of work on this, and she's worked with the it's come up really good. It's just put some bones around our business continuity work that we've been doing the last 4 or 5 years.
Excellent. Thank you. Well done, team.
If you've all had a read of that, I will get that all tidied up and we'll get that to the leadership team in the very near future.
I think the whole council needs to know it's happened once the leadership team signed it off, so it's not just us that knows about it, and I'll make a point of that in the minutes, perhaps when I'm presenting. So, because I think sometimes people think business continuity is about the main street as opposed to our business continuity. So I'll make that really clear as I'm presenting the minutes too.
With our current environment, business continuity is pretty important.
Oh, it's crucial.
And if leadership team have got a policy that they can use as a, not a weapon, but they can make sure that there's a policy in place and everyone has to adhere to it. Well, that's good. So moving on, so we've had a crisis management team in place for a couple of years. We've activated, I think, once, I think we've fully activated, but once again, we've now got a plan which to put those around pretty much what I think is a PowerPoint presentation. So that will go to the leadership team as well. Please sign off. And I guess during the work program, if Helen's got anything else, she can activate that discussion. So, yeah, just in summary, we are very busy doing a lot of ad hoc work, especially around the resurgence. COVID it doesn't really mess with our BAU because we get so many ad hoc calls, and as we discussed at our last meeting, our aim now is to front foot any issues. So by getting in touch with communicating with communities all the time, and referring people for welfare issues and those sort of things, getting on top is making our life a little bit easier than being behind. So it is pretty hectic, but we're managing, and I think everybody's sort of holding up. It's not easy. It's quite a negative environment out there. The community's not happy.
Yes, everyone's touchy, eh?
Yeah. So one thing we are going to continue working on, and we've had a discussion about this, is that we need to keep our training going, keep our interest in emergency management within staff. There's capacity staff to join us online. So once again, I think Helen will talk to that during our work program, which we are about to come to.
Shall we, anyone got any questions of Gary before we'll receive his report and then go on to the work program? Anybody got anything they want to add or say or ask? No? So I'll move the district manager's report, and you're seconding it, Terry, and all those in favour, and we'll go work.
Aye.
So I'll take the work program as read. If there was anything, you see everything is there's nothing of major concern. We are getting through the work program. As I say, it's a bit ad hoc for us at times, but we're ticking along okay with it. So I'll answer any questions, but what I'll do is I'll now refer to Helen first, just to speak to her parts of the work program. Is there, Helen?
Morning, Helen.
Morena. I think the key thing is around that training, as Gary alluded to, that there's a couple of things that have been put on hold or cancelled. So the first one was the 4th of November exercise. We were going to do a full setup exercise with our full EOC team in the council chambers. That is a Waikato-wide exercise, and just because a lot of our civil defence teams around the Waikato have been activated for COVID, probably less impact to us, but at the moment, for instance, Waikato and Hamilton are very busy. That's been deferred into the beginning of next year. The other key thing is that the formal integrated training framework courses that we're putting our staff through, the Waikato have cancelled those. So for August through to October. So what we're putting in place instead is running a few small team exercises from now to the end of the year, and making it part online for those that can't travel. So I'm still confident. I think we've got the best EOC team in place than the whole time I've been here. So I've got real confidence in the team. So that's been really good, and thank you to the leadership team for their support on that. The only other thing is, in terms of COVID, we've had our Eastern Waikato Local Welfare Committee, which is Haraki Matamata Piako and Thames-Coromandel. So last year we were delivering food parcels. This year we were meeting with all the service providers and food banks and MSD and ensuring they had enough resources and being the connector and facilitator. And that is a very strong committee. We're very lucky with that. And apart from that, it's been working on the three-part business continuity plan, the policy, the framework, and the crisis management plan, which, as Gary said, I think will be a benefit to the council. So unless there's any other questions, that's it from me.
I've got a question if I can.
Yes, go.
Sorry.
Yeah, go.
Oh yeah. I see that you've been doing some work around border control. Interested to see what's going on there. Have you been doing work around that, or I read that in the information somewhere?
So, yeah, I'm working with that, Terry. It's, so what we are doing is via the group, we are working on identifying possible locations for border management if we get if we start to isolate a little bit more. The Coromandel was easy. We're done and dusted in two minutes because there's 3 roads and that's it. So the Coromandel, but it's when you're looking at the Waikato, further down southern Waikato, Taupo area. So we're working with that. We're also liaising with police regarding roadblocks and, you know, the likes of the Naya who spring their roadblocks up, making sure that one of the police are aware of it. They certainly liaise with us on those sort of things. So once again, it's just a high level of communication regarding borders. The police have what they call a roving border management system in place at the moment. We go to Hamilton, and that's effective because we had a staff member turned back on Monday morning trying to get through to come back to work. So they are around and about. So yeah, so that's the gist of it. It's just a conduit role.
Okay, thank you.
Okay, Pam, you there?
Thanks, Helen.
Thanks, Helen.
Hi, sorry, my fingers are a bit slow. What am I talking on today? I'm just going to pick 2 of my things that I can talk to you about. The Tsunami signage boards. Terry had a question about the feedback on it. To date, I've installed about 50 boards from Whangamata to Wharikaho. Really well received by the community. The only people I've actually had feedback from are staff members and community response members because I've been communicating with them. They've seen them, they've noticed them. I've had one other member from the public in Whirianga suggest another location for a new sign. So I've created a new sign. We've got close to 20 signs in Whirianga. So that has been well received. And the next phase I've just sent off for printing is from Waikato Bay to Kennedy Bay. And that's 24 signs going up. Strategically placed, not to interfere with anybody's view, but good to capture visitors and locals. Whisper.
Yes.
Yes. We have a working group that has been set up, led by GMO, the Group Emergency Management Office, and we have been working through a lot of phases, questions, understanding the product. We've had to involve our IT department to make sure that they were happy with the system. It ends up that it really doesn't interfere with any of our systems. It's a cloud-based app. It is an alerting tool as well as a communications tool. So just GMO is paying for it. It's been approved by the KEG.
Yeah.
And basically, the 2 positives that I see with using the system, one is we currently don't have a communications system to talk to our internal staff. Something like this would really support the business continuity plans. So we have had discussions with people and capability. We're linking in with them so that we can create our distribution lists, contact lists of all staff. How are we going to do that? How are we going to copy it over? And how are we going to maintain it? We also have really good buy-in from them. This system supports a business case that they're presenting, as well as their support on this is invaluable because they hold all the information of staff. And the other positive of the Whisper, the biggest thing for us is it is another tool in our toolbox for emergency alerting to the public. And it pretty much covers that little section of people who say that they don't have mobile coverage, they don't have broadband, they're old, they don't own mobile phones, or old mobile phones that don't receive these alerts or apps that you need to install. Because Whisper is pretty much the public would have to sign up themselves to Whisper. There is absolutely no charge to anybody to sign up. They are responsible for inputting their data and updating it. What else? You have 3 options. One, to receive alerts. You can receive it via email, text alert, and calls to your landline phone. And not only does it just call once, it will continue calling with an automated voice message until you answer. That tells you what is the emergency and what do you need to do. Another good thing about Whisper is that it is sort of a one-stop shop for alerting. You push one button and it would automatically send the alerts out to the public, staff, your social media, all the platforms where you usually would need to send this alert. You do it on one place. And I believe that they are NEMA ensuring that it is linked in with Red Cross. So we wouldn't have to go to Whisper and Red Cross to send an alert. We'll just go to Whisper and it would go everywhere. Oh yes, one other thing about Whisper is it's not just an alerting tool or a communication tool out. It is really well set up for receiving response back as well, and that is really helpful for staff. At this point, by the end of the year, we will be getting council internal staff uploaded and ready to use Whisper. And early next year, it should be rolled out to the public. And I don't really know yet who's going to be promoting it, to answer David and Linda's question.
Right.
So the chances are at the moment we're going to sit within the emergency management unit for the Coromandel, because there has to be a control point for it.
Yeah.
So it's possibly where it'll sit. So group office will have, if it's a major event, they'll take it over, but if it's a localised event and we have the geofence messaging, I think it'll be managed by us.
Right.
So each, sorry, just one more thing. Each council has its own secure workspace where only 3 staff have access into it, but GMO also has access to send alerts on our behalf. And all the data and privacy is really secure. NEMA uses Whisper as well as Auckland Emergency Management.
Can I ask, I've forgotten, how's it signal sent? Is it by radio? Is it by internet?
I believe it is done through satellite.
GPS type stuff.
Mm.
Okay. Right. Okay.
What I'm hearing is the stereotypical, and I don't know how many of them are, of the little old lady living by herself with only a landline. They will be able to.
They'll be reached.
They will be reached, and I think that's what I think is really important. And the people that are in blind spots.
However, the obstacle with those people are, we need to know who they are. They don't generally have access to online, so they can't register themselves. So we have to find a way to actually find these vulnerable people and help them register. And that's what I'm going to use the community response groups for.
Well, exactly. And that's what I've always thought, that even if you get a message, if you are unable to leave the house by yourself or something, you've still got to have a neighbour or somebody that's going to come to your help. So the thing that once people know they'll be able to act isn't true. So makes perfect sense to me. Thank you.
Any further questions on that?
Yeah, I just want to go back to this. I'm still getting my head around this signalling of it. So with a lot of people with losing their copper lines and going to internet or taking their landlines out of their house, can you sort of explain how it goes into a landline? You got any data about
If you don't have a landline, you won't receive a call on the landline. You can't tick the landline call box. It's not an option.
Yeah, but if you've got a copper landline versus an internet landline, is that different? Does that make a difference?
Oh, I don't know. I'll take that question away with me and I will come back to you all with that.
That'd be great, thanks. Just keen to know the behind the scenes how it works. Thank you.
I understand, Terry, that it's every available platform. So you've got your satellite, you've got your fibre, you've got your cable, you've got your RDS. It's all of the platforms. I think we've been advised too that landlines won't be in existence in like 3 or 4 years. They're going to be disconnected nationally. So there's a little bit of playtime there.
But we've got landlines. We've got a fibre with a landline. You can have it. You just don't. They take the copper out and they put it in as a digital landline. So we still got landlines. But I just understanding how it works for those with copper versus the more advanced ones. So
we'll get back to you on that.
Yeah. Thank you.
Okay. Thanks, Pam.
You're
Anything
welcome.
else you want to add?
No, I just wanted to quickly touch on a new sort of initiative that has been started. It's the Waikato Community Response website that Drew from Group designed well over 2 years ago now, but I've not had the capacity to actually work on it. I've had some capacity to actually put some effort into it. This community response website is being designed for a Waikato volunteer group that we have and our community response groups. It's pretty much a platform that allows them to get private access to their own community page. On the page currently, for each community, I have got their community response plan, their brochures, their posters, and any other stuff that they feel they need in one secure place. I really like this website now that I've actually spent some time working on it because the public can access it, and you're welcome to go have a look at it. It is waikatocommunityresponse.gov.nz. Public can access it, but they have very limited access to the website. Volunteers and community response groups members have secure access. They can't see each other's plans. They can only see their group plans. There's forums where they can talk to each other, share stories, ideas, etc. They receive monthly newsletters, which is emailed out to them, but the newsletters are saved on there. There's opportunities for training, online training, and it really is the first time I feel like there's something tangible that we have for community response group members to get involved and take control of their planning. What else do I need to say about that? I think that's about it. It's still a work in progress. I'm rolling it out to community at a time, one community at a time. I need time to explain to them how to get in, how to work it. They need some time to play with it, and they come back to me, and I've actually learned how to build a website, how to make it better for them. So it will be an end product that is built for them.
Excellent, thank you. Anything, Robin or Terry, you want to ask or talk to the team about before I receive this report?
No, all clear. Thank you, Rory. Thank you.
I'd just like to thank you all hugely for the amount of work. I just know for myself, and my body's totally safe and my income's secure and we're all fine, how much COVID is affecting everything, and for you to keep going with business as usual, as well as that as an overlay the whole time. And I've got a sense we're only just beginning, really. And so really wanting to acknowledge your hard work and your interface with our community. So thank you all of you very much. And I'll move that we receive that report.
Second it.
Right, thanks, Terry. Robin, this is the members' reports. Have you got anything you want to say? If she's on mute. Terry, anything you want to say?
I just picked up from what Gary said about the cyclones this summer, and they talked about 9, but 2 or 3 of them could be a real issue for us, and wondering about the resilience around that. Is there any things that we should be aware of going into those, Gary?
Well, all I can say, I mean, it's early days yet. So what these, excuse me. So NIWA are very active in the space now because they've got some very good science around it. Yeah, like we were in an elevated situation last year at this time, and we didn't have, apart from a couple of storms, we didn't have a cyclone. So we may have the same this year. We may get 2 or 3. The beauty of a cyclone is that we know it's coming. We get 5 to 7 days warning. Its path is not locked in or determined until just a few hours before it arrives, but we get plenty of time to get communications out. So we're getting experience in that now. So yeah.
I'm thinking in terms of maybe you've got the sandbags spread around the Coromandel, haven't you?
Yep, and we're still working on that. We're actually, after this meeting, we've got another meeting regarding the distribution on it. So we're working on that. We'll have all the sandbags out and about. They won't nearly be enough for everybody, but at least it'll be something.
Yeah, for those key areas. Okay, I'll be interested to see how, yeah, hopefully we don't have too much drama over them, but thank you.
Thanks.
Yeah, and the other, yeah, let's hope they don't come our way, you know, and if they do, we've got time to prepare. Robin, anything you want to say? I see you're off mute. No, I've got nothing other than to thank people and just to, I just want to acknowledge the importance of what I believe the importance of vaccination and the role that you're playing, team and emergency management, in making that possible for our communities to take that opportunity up. So just want to acknowledge that, and I will be Rex Simpson, who you know is doing a radio slot from Goldfields on Saturday, and I'm going to be his roving reporter. So I will be, you know, on message vaccination and safety of us all and protection of our health service. So that's my members' report. So I'll move that we receive the members' report.
Happy to second it.
Thank you, Terry. And unless there's anything else anyone wants to say, that is the end of the meeting. So thank you very much for your attendance. Have good days, everyone. Stay safe and look after each other and be kind.
Well done, Sally.